Hi, Dr. Steve Segal here from LibertyvilleChiropractor.com. Um, Reading an article here. This is in the New York Times, and it's written by a medical doctor who is also a professor at Indiana University School of Medicine. He's a professor of pediatrics. And like the headline here says, for bad backs, it may be time to rethink bias about chiropractors. About two of every three people will probably experience significant low back pain at some point. A physician like me might suggest any number of potential treatments and therapies, but one I never considered was a referral for spinal manipulation. It appears I have been mistaken. For initial treatment of low back pain, it may be time for me and other physicians to rethink our bias. Spinal manipulation, along with other less traditional therapies like heat, meditation, and acupuncture, seem to be as effective as many other more medical therapies we prescribed, and as safe, if not safer. Most back pain resolves over time, so interventions that focus on relief of symptoms and allow the body to heal are ideal. Many of these can be non-pharmacological in nature, like work done by chiropractors or physical therapists. Physicians are traditionally wary of spinal manipulation, applying pressure on bones and joints, in part because the practitioners are often not medical doctors. I put that part in. And also because a few chiropractors have claimed they can address conditions that have little to do with the spine. Patients with back pain haven't seemed as skeptical. A large survey of them from 2002 through 2008 found that more than 30% sought chiropractic care, significantly more than those who sought massage, acupuncture, or homeopathy. Researchers have been looking at the evidence supporting spinal manipulation for some time. Almost 35 years ago, a systematic review evaluated the available research, most of which was judged to be low in quality, and found there might be some short-term benefits from the procedure. Two reviews from 2003 agree, for the most part, finding that spinal manipulation worked better than a sham procedure or placebo, but no better or worse than other options. Almost a decade later, the Cochrane Review assessed the literature once more and found 12 new trials had been conducted. This review was more damning. It found that spinal manipulation was no better than sham interventions. But since then, data have accumulated as more high-quality studies have been performed. Recently, the Journal of the American Medical Association researchers found for new studies since 2011, as well as those that have been performed before. The evidence from 15 randomized controlled trials, which included more than 1,700 patients, showed that spinal manipulation caused an improvement in pain of about 10 points on a 100-point scale. The evidence from 12 randomized controlled trials, which overlapped but not completely with the other trials of about 1,400 patients, showed that spinal manipulation also resulted in improvements in function. In February, in the Annals of Internal Medicine, another systematic review of non-pharmacological therapies generally agreed with other recent trials. Based upon this review and other evidence, the American College of Physicians released new clinical practice guidelines for the non-invasive treatment of subacute back pain. They recommend that patients should try heat massage, acupuncture, or spinal manipulation as a first line of therapy. Side note here, I'm not a big fan of heat in the acute phase, questionable in the subacute phase. The only thing that might detract from the use of spinal manipulation in this situation would be its cost and potential harms. Because they fear these potential harms, some physicians are hesitant to refer patients to chiropractors or physical therapists for care. But in all the studies summarized above, there were really no serious adverse events reported. It's possible to find antidotes of harm to the spinal cord from improper manipulations, but these are rare and almost never involve the lower spine. Some physicians are concerned about the cost of spinal manipulation, especially since most insurance carriers don't cover it. Visiting a chiropractor costs more than taking many non-narcotic pain medications. Uh, but more invasive interventions can cost a lot more money. For instance, sometimes you need MRIs, et cetera, et cetera. Those can certainly add to the bill. In addition, studies have shown that in general, users of complementary and alternative medicine spend less overall for back pain than users of only traditional medicine. Medication and surgery can also lead to harms. We shouldn't forget that prescription pain medications like opioids can lead to huge cost, especially when they're misused. Some physicians are uncomfortable that we don't have a clear picture of how spinal manipulation actually works to reduce pain. It's also possible that some chiropractors do it better than others, and we can't tell. Side note, that's absolutely true. There are some chiropractors that do the adjustments better than others, and just like there are some medical doctors that perform their procedures better than others, or dentists, or every other profession. This concern should be tempered by the fact that we don't have a great understanding of why many of the other therapies work either. Some of the more common traditional things we recommend don't even work consistently. Still, there's no merit to many other claims about spinal manipulation, that it has been proven to work for things like infantile colic, painful periods, asthma, gastrointestinal problems, and more. For most conditions, the therapy lacks a good evidence base. But given the natural course of back pain, that most of it goes away no matter what you do, the ideal approach is to treat the symptoms and let the body heal. Non-invasive therapies seem to do that well enough. Um, that's the article, and I think it's a great article because he's going back and saying, look, we looked at the research and we have to go back and continually look at the research in every field and then make our decisions as the information is brought to us. One of the things, if you want to get more information about me, you can visit my website at www.libertyvillechiropractor.com. What makes me different than other chiropractors is I have a simple visit by visit approach. It's common sense and it's cost effective. And we also show you what you can do outside the office to stay outside the office. So hope this provides some insight, and we'll talk to you soon.